Welcome to the Cancer Cure Conspiracy. I'm your host, and this is Episode 1, the $270 billion question. Why isn't there a cure? This is the question that haunts millions of cancer patients and their families. After 50 years and trillions of dollars spent on the war on cancer, why does a diagnosis still feel like a death sentence? Why are the treatments so brutal, so expensive, and so often ineffective? The answer is simple, brutal, and documented. The war was never meant to be won. Every year, 1.9 million Americans are diagnosed with cancer. Every year, the global cancer industry generates over $270 billion in revenue. That is more than the GDP of Finland, more than the GDP of New Zealand. It is a machine, a global financial empire built on human suffering. And like any empire, it is built to last, it is built to grow, it is built to protect itself at all costs. Let's be clear. This is not a story about doctors and nurses on the front lines. This is not a story about the researchers working tirelessly in their labs. This is a story about the system. A system that has been corrupted by money, power, and greed. A system that has been designed to profit from your illness, not to cure it. And a system that will do anything to protect its profits. Let's follow the money. The average cost of a new cancer drug in the United States is over $100,000 per year. Some drugs cost over $500,000. These are not prices based on research and development costs. These are prices based on what the market will bear, what a desperate patient will pay to live another few months. And the pharmaceutical companies that set these prices are among the most profitable corporations on earth. Pfizer, Roche Johnson & Johnson, Merck, Bristol Myers Squibb. These are not healthcare companies. They are financial entities whose primary obligation is to their shareholders, and their shareholders demand growth. Quarter after quarter, year after year, the only way to guarantee that growth is to ensure that the demand for their products never decreases. And the only way to ensure that demand never decreases is to ensure that cancer is never cured. Let's talk about the revolving door between the pharmaceutical industry and the regulatory agencies that are supposed to oversee them. The Food and Drug Administration is the gatekeeper of the American drug market, but who staffs the FDA? Who makes these decisions? Overwhelmingly, they are former pharmaceutical industry executives, and when they leave the FDA, where do they go? Back to the pharmaceutical industry with lucrative consulting contracts and board positions. Scott Gottlieb, former FDA commissioner, joined the board of Pfizer within months of leaving his government post. Richard Pazdur, the FDA's cancer czar, has been criticized for his close ties to the industry and his role in fast-tracking expensive, ineffective drugs. These are not isolated incidents, they are the rule. The fox is guarding the henhouse and the chickens are dying. Let's talk about the statistical tricks they use to make chemotherapy look more effective than it is. When pharmaceutical companies conduct clinical trials for new cancer drugs, they use a metric called progression-free survival. This measures how long a patient lives before their cancer starts growing again. It does not measure whether the patient actually lives longer. A drug can receive FDA approval based on extending progression-free survival by just a few weeks, even if it does not extend overall survival by a single day. And yet these drugs are marketed as breakthroughs. They are sold for hundreds of thousands of dollars. And patients and their families are told that this is their best hope. Let's talk about the human cost of this system. The toxic legacy of chemotherapy is not just physical, it is financial. The average cancer patient in the United States spends $150,000 out of pocket on treatment. Studies show that cancer patients are 2.5 times more likely to declare bankruptcy than people without cancer. Medical debt is the leading cause of personal bankruptcy in the United States, and cancer is the leading driver of medical debt. The industry has created a system where getting sick can cost you everything you have ever worked for. Your home, your savings, your children's college fund, all of it gone. Let's talk about the immune system paradox. Your immune system is your body's most powerful weapon against cancer. It is constantly surveilling your body, identifying and destroying abnormal cells before they can become tumors. The reason cancer develops in the first place is often because the immune system has been overwhelmed or compromised. So what does chemotherapy do? It destroys your immune system. It wipes out the very defense mechanism that your body needs to fight the cancer. This is not a side effect. This is a fundamental design flaw, and yet the industry continues to prescribe it as the standard of care. Let's talk about the enforcers of this system. The oncologists, the hospital systems, the insurance companies, and the medical schools that train the next generation of doctors. Medical schools in the United States receive substantial funding from pharmaceutical companies. A typical medical student receives less than 25 hours of nutrition education over 4 years of training. They are not taught about the relationship between diet, inflammation, and cancer. They are not taught about the metabolic theory of cancer. They are taught to diagnose and prescribe. And the drugs they prescribe are the ones that generate the most profit. Let's talk about the National Cancer Institute. The NCI has received over $160 billion in federal funding since the war on cancer was declared in 1971. $160 billion. And yet the 5-year survival rate for most solid tumors has barely moved in 50 years. Where did all that money go? It went to research that was designed to produce patentable drugs. Research into natural compounds, dietary interventions, metabolic therapies. Anything that cannot be patented and sold for a profit receives a tiny fraction of the available funding. The system is not designed to find a cure. It is designed to find the next blockbuster drug. Let's talk about the metabolic theory of cancer. In 1931, the German biochemist Otto Warburg won the Nobel Prize in Physiology or Medicine for his discovery that cancer cells have a fundamentally different metabolism than healthy cells. Cancer cells, Warburg found, rely almost exclusively on glucose, sugar, for energy. They cannot efficiently use oxygen for energy the way healthy cells do. This is known as the Warburg effect. The implications of this discovery are profound. If cancer cells are dependent on glucose, then starving them of glucose through dietary interventions like the ketogenic diet or through drugs that block glucose metabolism could potentially be an effective treatment strategy. And indeed, there is a growing body of research suggesting exactly that. But this research receives almost no funding from the major cancer research institutions because you cannot patent a ketogenic diet. You cannot charge $100,000 for a glucose-blocking protocol. There is no profit in it. Let's talk about the pediatric cancer tragedy. Children with cancer are among the most heartbreaking victims of the chemotherapy cartel. The standard treatment for childhood leukemia, the most common childhood cancer, is aggressive chemotherapy. These children are subjected to years of toxic treatment that can cause permanent damage to their developing brains, hearts, and reproductive systems. Many childhood cancer survivors grow up to face serious health consequences from the very treatment that was supposed to save them. And yet the industry continues to use the same toxic protocols decade after decade because changing the standard of care would require admitting that the current approach is inadequate. Let's talk about the global contrast. In countries where the pharmaceutical industry has less control over the medical establishment, different approaches to cancer treatment are being explored. In Germany, integrative oncology centers combine conventional treatment with metabolic therapies, immune-boosting protocols, and nutritional interventions. In Japan, the use of fermented soy products and green tea as cancer preventive agents is well established. In Cuba, where the pharmaceutical industry has no influence over the medical system, researchers have developed a lung cancer vaccine that has shown remarkable results. But in the United States, these approaches are dismissed, marginalized, and in some cases actively suppressed. Let's talk about the lobbying machine that protects the chemotherapy cartel. The pharmaceutical industry spends more on lobbying than any other industry in the United States. In 2023, the industry spent nearly $294 million on federal lobbying alone. This money buys influence at every level of government, in Congress, in the regulatory agencies, and in the White House. It ensures that drug prices remain unregulated. It ensures that Medicare cannot negotiate drug prices. It ensures that the FDA continues to approve drugs based on surrogate endpoints rather than actual survival benefits. It ensures that the status quo is maintained no matter how many people die. Let's talk about the cancer charities. The Susan G. Komen Foundation, the American Cancer Society, the Leukemia and Lymphoma Society, these organizations raise billions of dollars every year in the name of finding a cure for cancer. But where does that money go? A significant portion goes to administrative costs, executive salaries, and pharmaceutical research. The American Cancer Society has received hundreds of millions of dollars from pharmaceutical companies. It lobbies against drug price controls. It supports the very system that is profiting from cancer. These are not charities, they are marketing arms of the pharmaceutical industry. Let's talk about the screening trap. Mammograms, PSA tests, colonoscopies, these screening tools are marketed as life-saving interventions, and in some cases they are. But they also generate enormous amounts of what doctors call overdiagnosis, the detection of cancers that would never have caused harm if left untreated. Studies suggest that mammography leads to the overdiagnosis and overtreatment of breast cancer in as many as 30% of cases. These women undergo surgery, radiation, and chemotherapy for cancers that would never have threatened their lives. The industry profits. The patients suffer. Let's talk about the environmental silence. We know that environmental factors, industrial chemicals, pesticides, processed food, air pollution, are major contributors to cancer rates. The United States has some of the highest cancer rates in the world. We also have some of the highest levels of industrial chemical exposure, pesticide use, and processed food consumption. But the cancer industry does not focus on prevention, it does not lobby for stricter environmental regulations. It does not advocate for cleaner food and water, because prevention does not generate profit, treatment does. Let's talk about the Rockefeller connection. In the early 20th century, John D. Rockefeller and his associates used their enormous wealth to reshape American medicine. They funded the Flexner Report of 1910, which led to the closure of most alternative medicine schools in the United States and the standardization of medical education around pharmaceutical-based treatment. They established the American Medical Association as the gatekeeper of medical legitimacy. They created a system in which the only acceptable treatments were those that could be manufactured and sold by the pharmaceutical industry. This was not an accident. It was a deliberate strategy to monopolize the healthcare market. And it worked. It worked so well that we are still living with the consequences over 100 years later. Let's talk about the courageous doctors who have spoken out against this system. Dr. Linus Pauling, the only person to win 2 unshared Nobel Prizes, spent the last decades of his life advocating for high-dose vitamin C as a cancer treatment. He was ridiculed and marginalized by the medical establishment. Dr. Nicholas Gonzalez developed a nutritional protocol for pancreatic cancer that showed remarkable results in clinical studies. He was dismissed and his work was suppressed. Dr. Stanislaw Berzinski developed antineoplastin therapy, a non-toxic cancer treatment that showed promise in clinical trials. He was subjected to multiple FDA prosecutions and attempts to shut down his clinic. The pattern is always the same. A doctor develops a promising, non-toxic treatment. The establishment attacks them, their work is buried, and the chemotherapy cartel continues unchallenged. Let's talk about the immunotherapy revolution. It is being hailed as the future of cancer treatment. And there is genuine promise in immunotherapy. The idea of using the body's own immune system to fight cancer is scientifically sound. But the way immunotherapy is being developed and deployed is following the same profit-driven model as chemotherapy. Immunotherapy drugs cost hundreds of thousands of dollars per year. They work in only a minority of patients. And the research into how to make them work better, through dietary interventions, metabolic support, and immune-boosting protocols is being largely ignored because it would reduce the need for the expensive drugs. Let's talk about the placebo effect. It is more powerful than the industry wants you to know. Studies have shown that patients who believe they are receiving effective treatment have significantly better outcomes than those who do not. The power of the mind-body connection in cancer treatment is well documented but largely ignored by the mainstream medical establishment. Because you cannot patent hope, you cannot charge $100,000 for belief, the industry profits from despair, from the idea that cancer is a death sentence that can only be managed, never cured, and only with their products. Let's talk about the insanity of the current system. It is captured in a single statistic. In 2022, the FDA approved 37 new cancer drugs. The median cost of these drugs was $200,000 per year. The median improvement in overall survival was 2.4 months. 2.4 months for $200,000. This is what the cancer industry calls progress. This is what they call a breakthrough. And the mainstream media, funded by pharmaceutical advertising, reports it as such, without question, without context, without shame. Let's talk about the integrative future. It is possible. There is a growing movement of oncologists, researchers, and patients who are demanding a different approach. Integrative oncology combines the best of conventional medicine with evidence-based natural therapies, nutritional interventions, and mind-body practices. Studies show that patients who receive integrative care alongside conventional treatment have better outcomes, fewer side effects, and higher quality of life. But integrative oncology receives a tiny fraction of the research funding that conventional chemotherapy receives. Let's talk about the fasting mimicking diet. Developed by Dr. Walter Longo at the University of Southern California, it has shown remarkable promise in combination with chemotherapy. Studies suggest that fasting before and during chemotherapy can make the treatment more effective while reducing side effects. But this research is not being promoted by the major cancer centers because it reduces the need for supportive care drugs, the anti-nausea medications, the growth factors, the antibiotics that generate additional revenue for the industry. Let's talk about the oxygen factor. It is one of the most suppressed areas of cancer research. Hyperbaric oxygen therapy involves breathing pure oxygen in a pressurized chamber. Cancer cells, which rely on anaerobic metabolism, are highly sensitive to oxygen. Multiple studies have shown that hyperbaric oxygen therapy can enhance the effectiveness of conventional cancer treatment and may have direct anti-cancer effects. But it is not a pharmaceutical product. It cannot be patented. It cannot generate the kind of profit that the industry requires, and so it remains on the margins of cancer treatment, available only to those who know to seek it out. Let's talk about the information revolution. It is changing everything. For the first time in history, patients have access to the same scientific literature that their doctors do. They can read the studies, they can evaluate the evidence, they can make informed decisions about their own treatment, and they are doing so in growing numbers. Online communities of cancer patients and survivors are sharing information about alternative and integrative treatments. Whistleblower doctors are speaking out on podcasts and social media. The monopoly on medical knowledge is breaking down, and the industry is terrified. You have the power to say no. You have the right to refuse any treatment that you do not believe is in your best interest. You have the right to seek a second opinion. You have the right to explore alternative and integrative treatments. You have the right to make informed decisions about your own body. The cancer industry has spent decades convincing patients that they are helpless, that their only option is to submit to the standard of care and hope for the best. That is a lie. You are not helpless. You are a human being with agency, intelligence, and the right to fight for your own life on your own terms. The system is rigged. From the research funding to the clinical trials, from the FDA approval process to the oncologist's prescription pad, every step of the cancer treatment pathway has been designed to maximize profit. Taxpayer money funds the basic research. Pharmaceutical companies take that research and develop patented drugs. Hospitals mark up those drugs by hundreds of %. Insurance companies pass the costs on to patients. Patients go bankrupt, and the cycle continues. This is not healthcare. This is a wealth transfer machine, and it is operating at your expense. We must demand accountability. We must demand an end to the revolving door between the pharmaceutical industry and the regulatory agencies. We must demand full transparency in drug pricing. We must demand that the FDA approve drugs based on actual survival benefits, not surrogate endpoints. We must demand that the NCI fund research into non-patentable treatments. We must demand that oncologists be prohibited from profiting directly from the drugs they prescribe. These are not radical demands. They are the minimum requirements of a healthcare system that actually serves patients. Support independent media. The mainstream media will not tell you this story. They are sponsored by the same pharmaceutical companies that profit from cancer. The truth is being told by independent journalists, whistleblower doctors, and platforms like WordUp Media Network. Support us, share our content, subscribe to our channel, because the only way to break the stranglehold of the cancer industry is to break the information monopoly that protects it. The awakening is happening. Millions of people around the world are waking up to the truth about the cancer industry. They are asking the right questions. They are demanding better answers. They are refusing to accept a system that profits from their suffering. We are at a tipping point. The cancer industry knows it. That is why they are working so hard to suppress this information. But the truth cannot be suppressed forever. Share this video, send it to everyone you know, post it on every platform. The algorithm will try to bury it, the industry will try to discredit it. But if enough people see it, if enough people ask the right questions, if enough people demand change, then change will come. Lives are at stake, not just your life. The lives of your parents, your children, your friends. Everyone is at risk. Everyone deserves to know the truth. The cure is not a pill. The cure is the truth. And the truth is this. The cancer industry is not in the business of curing cancer. It is in the business of treating cancer. Permanently, indefinitely, for profit, until we change that fundamental reality, until we demand a healthcare system that is actually designed to make people healthy, the suffering will continue, the bankruptcies will continue, the deaths will continue, and the profits will continue to flow. This is WordUp Media Network. Unfiltered, unforgiving, unapologetic. We bring you the stories that shape our world, exposing the unseen and questioning the accepted. Subscribe now, share this video, and join the movement to take back our health, our money, and our lives from the cancer cartel. The revolution starts now. Let's talk about the numbers that tell the real story. In 1971, when President Nixon declared the war on cancer, the lifetime risk of developing cancer in the United States was approximately 1 in 4. Today, it is 1 in 2. 1 in 2 Americans will be diagnosed with cancer in their lifetime. After 50 years and over $160 billion in federal research funding, we have gone from 1 in 4 to 1 in 2. That is not progress. That is failure. And it is a failure that has been extraordinarily profitable for the cancer industry. Let's talk about the drug pricing scandal in detail. Revlimid, a drug made by Bristol Myers Squibb for multiple myeloma, costs over $800 per pill, a single pill. A monthly supply costs over $20,000. The drug was developed with significant taxpayer funding through the National Institutes of Health, but the profits flow entirely to the pharmaceutical company. Gleevec, a breakthrough leukemia drug made by Novartis, was priced at $26,000 per year when it launched in 2001. Today, the same drug costs over $120,000 per year. The drug hasn't changed. The research costs were recovered long ago. The only thing that changed is what the company decided it could charge. And they charged as much as the market would bear because there is no law that stops them. Let's talk about the hospital markup. When a cancer patient receives chemotherapy in a hospital setting, the hospital purchases the drug at wholesale price and then bills the insurance company or the patient at a markup of 100 to 300%. This practice is standard. It is legal, and it generates billions of dollars in revenue for hospital systems every year. The hospitals are not providing a service. They are acting as distributors, marking up a product that a patient has no choice but to buy. And the patient, in the most vulnerable moment of their life, has no power to negotiate. Let's talk about the insurance industry's role in this system. Health insurance companies are supposed to protect patients from catastrophic medical costs, but in the cancer industry, they have become co-conspirators. Insurance companies negotiate secret rebates and discounts with pharmaceutical companies. These rebates are not passed on to patients. They are kept by the insurance companies as profit. Meanwhile, patients face high deductibles, copays, and out-of-pocket maximums that can still amount to tens of thousands of dollars. The insurance system does not protect cancer patients. It extracts maximum value from them while appearing to provide protection. Let's talk about the media's role in maintaining this system. The major television networks, newspapers, and online platforms receive billions of dollars in pharmaceutical advertising revenue every year. In 2023, pharmaceutical companies spent over $6 billion on direct-to-consumer advertising in the United States alone. That money flows to the media companies. And in return, the media companies do not bite the hand that feeds them. They run the press releases. They celebrate the breakthroughs. They interview the industry spokespersons. They never follow the money. They never ask the hard questions. And when independent journalists try to expose the corruption, they are dismissed as conspiracy theorists. Let's talk about what real progress would look like. Real progress would mean funding research into non-patentable treatments. Real progress would mean separating drug pricing from research costs. Real progress would mean ending the revolving door between the FDA and the pharmaceutical industry. Real progress would mean requiring oncologists to disclose their financial relationships with drug companies before prescribing. Real progress would mean investing in prevention, in clean food, clean water, clean air, rather than in managing the diseases that result from a toxic environment. Real progress would mean treating patients as human beings, not revenue units. And real progress would mean demanding accountability from the executives, the lobbyists, the regulators, and the politicians who have built and protected the system at the cost of millions of lives. We are not powerless, we are not alone, and we are not going to stop. This is WordUp Media Network, and this is only the beginning.